Good morning, Southern Illinois. This is George Goodman with the Just Listen by George Goodman, hosted live. Welcome to my podcast. I have been doing things a little earlier, got a lot going on, but also since I'm doing it live, whenever you want to watch it, you can. You can also comment on the content, etc. And as I've told you before, I try to be brief and concise, and I want to inspire you to get involved locally in politics. Excuse me. So let's dive in. So today, I want to do something a little different. I did a U.S. federal government policy on uh, health insurance. So I don't want to bore you with all of the regulations and etc. I want to talk to you about two things that you probably didn't know about health insurance in Illinois. Now, the health insurance in Illinois that I'm talking about is qualifying for Medicaid. Now, in case you didn't know, children qualify based on not having parents or parents who are single and are not making a lot of money. Now, I talked about something called the federal poverty level. Now, I talked about that at the national level too. So in 1965 to 1982, Congress let economists come up with a formula of how you could qualify, right? Because most of us would think, okay, well, I make X amount of dollars and here is my need. Okay. Need is left out of it. So that's a critical thing, even in Illinois, that has changed that most people don't realize. And it changed back in the 60s, and no politician talks about it. So the federal poverty level. So for adults to qualify for free or low cost, you have to be 138% of the federal poverty level. So that's a mathematical equation that an economist made up in the 60s that they've added to. So for any entitlements in the state of Illinois, you have to meet that criteria. They don't look at your need. So if you're an adult 19 through 64, if you make over $1,799 a month, you do not qualify for health insurance in Illinois. Pregnant people, believe it or not, is 213% of the federal poverty level. So if you make over $2,787 a month, you don't qualify if you have a household of two. So we're talking about single people, maybe, household of two, children, all kids. So it's 318% of the federal property level. So that means that if you make over $4,229 a month for a family of two, you do not qualify. So senior and disabled, you can only, so that's 100% of the federal poverty level. You can't make over $1,330 a month if you're a single person. Now, I'm going to voice an opinion here. So, excuse me, if you are senior or disabled, my impression would be that it should be free, especially if you're disabled. Why are we charging folks to be on Medicaid if they're disabled? And seniors should get one too. Most people in Social Security get more than that. That's why they charge you a premium, just in case you didn't know. Now, these are the rules in Illinois. Now, other states might be different, but we're talking about Illinois. So, qualifying for private insurance, Get Covered Illinois. So, in case you didn't know that, because I was getting a ride home from the dealership, and I started talking to this gentleman giving me a ride, and he was telling me about the health insurance in Illinois. So that just got me thinking that I wanted to find out about it. Okay, so if your income is too high for Medicaid, you can buy a plan through Get Covered Illinois. You can qualify for premium tax credits to lower your monthly costs. Okay, so we know that the premium tax credits are gone now. Again, state of Illinois, your income is between 100 to 400% of the federal poverty level (FPL), 15,960 to 62,600 for an individual. So if you make more than that, now they don't tell you why the range and etc. But basically, if you make under $15,960, you can get the private insurance. And I can tell you that gentleman told me that it is expensive. You do not have access to affordable insurance through an employer, defined as costing 9.96 or less of your income. Now, that one is tricky. I may have to look that one up for more details. All right. So you can get private insurance if you can't get Medicaid. And based on what I'm seeing, qualifying for Medicaid is pretty difficult unless you're able bodied and you just cannot find a job or not working. So it seems like in Illinois, if you are trying to earn a living, which 95% of us are doing, health insurance is tough to get in Illinois. And I have been telling you about what the legislature and the governor have been doing, and none of that is on the radar. Now, here's something that you don't know. What is the budget? What is the budget for this? Okay, so guess what? Illinois, in fiscal year 2025, the federal government provided 20.9 billion, covering approximately 62% of Illinois' total Medicaid spending. The remaining 12.8 billion was covered by state funds and provider taxes. Federal reimbursement rates. That's the criterion. Illinois typically receives roughly 50 cent reimbursement from the federal government for every dollar spent on most Medicaid programs. So for the Affordable Care Act, the Medicaid expansion group, the federal government covers a much higher rate, 90%. So that's a lot to unpack. So we know that there are reimbursement rates. Rural healthcare grants. Remember, that was a big topic 4, 5, 6 months ago for the country and for Illinois. So Illinois is set to receive 193 million annually for 5 years, starting in 2026, for the Federal Rural Health Transformation Program. So there is money coming in. 20.9 billion Medicaid funding, federal reimbursement rate, rural healthcare grants. But here's the thing, and it's the same way on the federal level. The threshold to qualify is so low that people get the perception, whether it's true or not, that if you're able-bodied and not working, you're going to get the bulk of the money. And that's where the fights have been between the state and the federal government. Who qualifies? So if I'm not working, now I'm in a different category. I will be a senior in 3 years. I've had a good career, so I've had healthcare insurance. I also retired from the military. Everybody is not in the same category boat that I'm in. And so what I'm submitting to you is that we need to ensure, my opinion, everybody to some degree. Why are we incentivizing people not to work to qualify? So if I'm fresh out of college and with this knowledge, I'm better off trying to get a low paying job just to get the benefits. And the people working two and three jobs or entry level jobs coming into the job market, they're coming out of pocket. Now, here's something that some of you probably don't know. My generation, I'm 62, a lot of us, the reason that we would go into the military was for the medical benefits to have children. So if you're an active duty military, the cost of having kids is zero. That's what we used to do. So, and people don't have that knowledge now because for whatever reason, certain things are not promoted by the military like they used to. But my point is, health insurance has always been a problem to qualify for in the first place. So, I think that that was important. I hope that I have given you knowledge. Knowledge is power equals voting. And I bring everything back to the midterms. Who we elect locally and statewide gives us power to make changes. Is healthcare insurance for Illinois at the point that it is fair for the people who are paying voters who are paying the taxes who cannot access it. So let me know what you think. And Friday, I will tell you what the candidates are doing, and we'll see what Illinoisans have been up to, and if people are going to the websites. And as usual, this is George Goodman with Just Listen Live Podcasts. See you on Friday. Have a great week.